So we had a doctor to speak and share his experiences as a medical doctor and using this technology. He also understands TCM, traditional Chinese medicine, and he also understands acupuncture besides also a medical doctor. I really admire Dr. Jonathan because he understands both sides of the world of healing their patients. So without further ado, I would like to introduce Dr. Jonathan Puesan.
Thank you so much, Brother Roy. Thank you
All
for
right.
inviting me on the call. It's a pleasure to be with you guys. That's why since I started with Liveway, I try not to miss any of the Zooms because I want to learn, educate myself, just like I've done all my life. Basically educating. I come from a family of physicians in the health field. I have a very extensive background in not only medicine but also in traditional Chinese medicine as well too. Got aware of the traditional Chinese medicine at the age of 13. So and I've always been in martial arts since the age of 6 and had two Oriental doctors, a Chinese doctor and a Korean doctor. So I said someday when I become a doctor, I also want to learn the Chinese medicine. So I've lived all my life in New York, Queens, New York. I'm from Queens, New York. Right now I'm currently living in Florida today, but all my family is in New York. So I had the honor to work in several hospitals in New York. I worked also in China, also as well too, in Mexico. I also have a degree and a background also in nutrition as well. So that's also a plus because it gives me an opportunity to not only see traditional medicine, but also the alternative medicine also as well too. Living in China also opened up my eyes to, even though my eyes was already open since the age of 13, about Chinese medicine as well too. So right now, what I'm trying to do is put everything, all the knowledge together and everything, and try to find a way to really help my patients have the 100% benefit in general overall health. I'm a general surgeon by trade, at 33 years as a doctor, and in the traditional Chinese medicine, I would say roughly about good 30 plus years. In that.
Wow.
So when I learned about technology of LifeWave, that really opened up my eyes because this is the second approach to being a part of LifeWave. One of the things that I tell everyone is that if they introduce you to something, or if you approach someone and they say no, it's not really a no. Just go back again, because what happened to me was I was introduced to LifeWave 5 years ago, but I never saw a patch. I was never given the training. Everything was through a patient of mine who also was a networker, but I didn't show any interest because I didn't know what I was getting involved with until recently, 4 months ago, when I got approached to it again. Second time, I called one of my patients upline in Mexico. I called her and I said, everybody's calling me, to learn about LifeWave. But, out of ethic and, being the type of person I am, I called her and said, I want to learn more. I want to know what this is all about. And that's when she introduced me to Brother Lorenzo. And I said, you know what, I'll educate me. Tell me as much as you can. I want to learn a lot about, LifeWave. Because once now that I got a little bit of knowledge and understanding of LifeWave, and I want that to be able to grow and expand a lot more, so that in the future I'll be able to share more with everybody on the team. So I said, hey, this is working the meridians. Patching is easy in a way that if you learn basic concept, you'll be able to really go far. So one of the things that helped me was one of the opened up my eyes the most is that you have to be a product of the product. I'll give you my testimony while I believe so much in LifeWave. Through the martial art experience and everything, I came across having maybe a leg injury or nerve. I would say maybe a nerve injury. That's my wife of 30 years. We've been happily married 30 years, and she's my right hand basically. She's a pharmacist as well too. So my testimony that I want to share with you is that when I went to the orthopedic surgeon to see what was the problem with my leg, he went through CAT scan, he went through CT scans, he went through X-rays, and he came back to me after putting my leg in a cast for 6 weeks. He says, I can't find anything wrong, and I can't operate on something that I can't see. And I said, yeah, but I'm feeling the pain. He says, well, the only thing I could suggest to you is take some Tylenol, take some ibuprofen, and whenever you feel pain. So for like 3 weeks before I became involved with LifeWave, I was taking like every other day. I was taking like 1,000 milligrams of Tylenol. I was taking 800 milligrams of ibuprofen, off and on, off and on, off and on. And what happened was that I said, something's got to give. And when I started using the lightweight patch and I put it within the first day, I would say the pain reduced significantly. And within a week, I was like, oh, wow, this is really awesome. So I started believing more and more. So then I said, okay, I'm going to start giving it to my patients and see how they respond to it as well. So when I started using it on the patient as well, too, I started getting great response. There was one of my patients with a shoulder and knee surgery over a year going to TMC, the traditional Chinese medicine doctors, going through physical therapists, on medications, nothing worked. So I said, you know what, we're going to have to do something what's called, 15 days rejuvenation cycle, which we're going to give you a protocol for 15 days and see how that goes. But I said, as soon as that 15 days ends, you're going to redo it again for another 15 days right away. And then we'll see how it goes. Within the first day of patching her, it was miraculous. It was like a miracle right away, because within like 10, 15 minutes, she said, wow, I feel like I've never felt, in years, basically, with this pain. So I was saying, wow, I'm onto something right now. And then I experienced it with my wife, my daughter, and several more patients. So I know this technology that we have is a miracle technology. I think that it's going to take us really, really far. And as a physician, and also in alternative medicine and also in nutrition, I want to be able to learn as much as possible so that I can educate not only my patients, but also the team as well, too. This is when I was in China. I was given the recognition by also the government in China, in on the traditional Chinese medicine. I was given an award from studying there, and it was fascinating because I was able to learn somewhat Mandarin. And now, after so many years, I'm just got back started again, learning Mandarin again, because I have also in my genealogy and family genealogy, somewhat also Chinese too as well. So, but and I realized that I was like, wow, there's something that I didn't even know as I got older, when I heard that my mom's dad was part Chinese. So I was like, wow, look at that. It's no wonder, since why I chose martial arts from an early age and picked an interest in Chinese medicine as well from an early age as well too. And my dad being a doctor, I said, there's something that I really want to carry on. And my daughter now, she's also in the medical field too as well, in second year.
Ah,
So this was one of my Chinese tutor in Mandarin. She was one of my tutors. So it was great. We still keep in touch and everything. So it's really interesting, to see the growth, how far you can get, and how much you can help others. And that's what I like. I like to be able to help people and educate them and do as much as I can with them and orient them. This is one of the hospitals I was at in Beijing, the Royal Integrative Medicine Hospital, which they integrate both the traditional medicine and the Oriental medicine as well. And it was an honor and a pleasure to be there for that amount of time there. And I mean, I want to go back there again in China. I loved it while I was there. And maybe hopefully by growing LifeWave will give me the opportunity to also have a team in China and be able to visit there as well too, and maybe stay there a little bit longer as well. But the experience that I've had is that I'm uncomparable to anything that I've done in the past with LifeWave. So I'm just saying that if anybody's thinking about it twice, don't think about it. This is something that's real, something that's going to grow eventually. And you'll start noticing how much people you can reach out to and how many people you'll be able to help alleviate some of those pains that they're having. This is one of the surgical procedures I had to deliver a baby. And that was one of the babies I had delivered back then.
mm. You're doing everything, doctor.
Well, I'm trying to really be able to be overall have an overall knowledge in a little bit of everything, and like I said, to be able to share that is a pleasure. It's a blessing, and to be a part of this team is a bigger blessing. To have you with so much knowledge and so much experience, so many years, 19 years plus in LifeWave. I mean, that's unheard of to be able to have a team like that. And this is a team that everybody wants to be a part of.
Thank you, doctor. Thank you.
Mm-hmm.
Yeah. All right. That's
Thank you
amazing.
so much.
Amazing. So you are a medical doctor, and what is your specialty in the medical doctor?
I'm a general surgeon by trade,
Oh,
33 years
surgeon.
as a
Okay.
surgeon. And I have a title in traditional Chinese medicine as well, and in clinical nutrition too as well. And then when I was in New York, I was also awarded in HIV for the Department of Health in New York. I was also working with HIV patients as well too. My daughter was a twin. She was a part of a twin, and I lost the boy. So I just have
Oh,
the one right now, and she's a God gift and a blessing. She's been the type of daughter everyone would be proud of to have. Uh, she's 20 years old, and she's in second year pre med. This is my little bit history about the martial arts. I've done martial arts for 50 years. I'm an eighth degree black belt in Taekwondo and Hapkido. And I also did traditional Kung Fu, Shaolin Kung Fu for 16 years, also in New York, in Chinatown. That's in New York, in Chinatown, Canal Street. We did the line dance, the dragon dance over there in Chinatown for the New Year's. And I was competing in many, many tournaments. I've won every single tournament that I entered. And this was, I used to be a fan of Bruce Lee, and I was showing here how to do one thumb push up. I used to do 20 push ups nonstop on one thumb.
yes, yes, yes.
And,
So,
and
doctor,
in,
let me ask you this question. Like when
sure.
you see a patient, they have pain, how do you handle that, doctor?
Okay, usually when if I have a patient that's coming in, I see, like, I'll give you an example. I had a patient like 4 weeks ago, about a month ago. She came in, she was limping and hurting. She's a professional model, and I approached and I said, "What's wrong?" And she goes, "Oh, I hurt my knees. I was going to the gym. I was working out." And I told her, I said, are you open minded to willing to try something alternative? She goes, of course. And I said, I have these patches. I gave her a glass of water first to drink. I said, I want you to drink this water. She drank the glass of water. And I said, allow me to patch you. And what I did is I took an iron patch and I put it on C7 right behind her neck. And then I automatically said, pinpoint exactly where the pain is located. So she showed me on her knee where the pain was. So I located and I put a brown patch right there. And then right above it, about 12 o'clock, looking at a clock, right about 12 o'clock, I put the white one. And then I gave
Mm,
another glass of water right away. And then I
right.
waited about a minute and a half. And I said, how's your pain? She said, well, let me see. She started walking. She started bending her knees. She goes, oh my God, what's this? How come the pain went away so fast? And I say, no, it's the technology that we have that's really going to help you. I said, let's wait a while I gave her a consultation and everything. And at the end, I told her, how you feel? How's your knee feels? And she goes, wow, it feels awesome. I said, okay, do you want to get the whole pack, or do you want to become a preferred customer? I can get you. I signed her up as a preferred customer. So I didn't charge her the $5. Normally I would charge them $5 if they didn't want to purchase anything. I would charge them $5. So if I gave them 3 patches, I put on 3 patches, I would charge them $15. But in this situation, because she was willing to become a preferred customer, I said, no, there's no fee. I'm not charging you anything for it. But she left really happy. And then out of that came out another referral, so it was
Oh, there you
awesome.
go.
Yeah.
There you
So
go. There you go.
I
That's
usually,
great.
I usually, usually, I observe them first, see what are they complaining of. If they have certain pains, and that's why I will give them the alternative. I will say, you open minded to trying something different, and they say, sure, definitely. I just want to get rid of this pain. I said, okay, and I will just give them, I'll patch them and then give them information right afterwards.
Wow. That is really amazing, doctor. That's really amazing. Doctor, thank you
No,
for
thank you so
sharing
much
all
for
this. Yeah,
definitely.
and we really appreciate your time. And for everybody, stay patched, stay healthy,
Mhm.
and I wish you all the best. All right. God bless you all.
Thank